I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Good morning, everyone. Good morning, fellow commissioners. It's nice to see everyone here this morning. Those of you that are here in person and those of you that are live streaming or listening at home, welcome. This is the regular commission meeting of Tuesday, October 1st, 2024. It is 8:30 a.m., so I guess we're ready to commence business. Before I entertain a motion, is there any public input on the agenda? If not, I'll entertain a motion to approve the agenda.
Mr. Chairman, can we flip-flop item 8 and 9? They look a little bit out of order to me.
Flip-flop items 8 and 9. Okay, you want 9 going before 8. We can do that.
Thank you.
Any other-
With that, I would make a motion to approve.
Okay, we have a motion. Is there a second?
Second.
Okay, there's a motion by Landine, a second by Schmidt for the approved agenda. Any discussion? If not, call the roll, please.
Commissioner Aaron's,
Yes.
Poppins,
Yes.
Landine,
Yes.
Schmidt,
Yes.
Gibbon.
Yes. Next, any public input to approve the consent agenda items? If not, I'll entertain a motion.
So moved.
To approve?
I'll second.
Motion by Schmidt, second by Landine. Any discussion? Call the roll, please.
Commissioner Aaron's,
Yes.
Poppins,
Yes.
Landine,
Yes.
Schmidt,
Yes.
Gibbon.
Yes. Very good. All right, we will begin then with our regular business. Item number 1, Alicia.
This is a public hearing to consider an application for a temporary on-sale liquor license to operate outside the municipality for David Dershawn, 57015 Bar LLC, Chancellor Bar, for an event to occur on October 5th, 2024, located at Prosper Country Warehouse and Event Hall, 46620 278th Street, Lenox, South Dakota, 57039. This is license number 4 of 6 allotted for this calendar year.
Is the applicant here?
Yeah.
Okay, would you like to come forward, please? State your name and address and what you're doing.
Oh, I'm Dave Dersh, and I have, applying for the liquor license. All it is, my address is in Chancellor, South Dakota.
What is your address again?
Yeah, my address would be 304 South Main in Chancellor. We're doing it for the Prosper, which is,
Oh, yes,
NT.
okay. And anything else you'd like to tell us about your application here?
Not really, no, just applying for the liquor license so they can have it for the wedding.
Okay, any questions by the commission? Okay, is there, thank you, you can be seated. Is there any, before I ask for a motion, any public input?
Public hearing.
Or, excuse me, that's right, this is a public hearing. Okay, proponents, all those in favor or support of the applicant? Okay, no proponents, any opponents? Okay, good. If,
Mr. Chair.
Yes.
On these things, what we used to do, nothing, Dave, but we always did a background check to see whether, we did a background check. I was there, you know, I know you've been here a long time, but I was here before gray hair. Anyway, now we waive that? Is that what we do? We don't need that anymore? Okay.
all right,
They
okay.
hold they hold a liquor license under the state, so the state has the.
Okay. And there's no is there any public input on this? No? Okay, I guess I'm ready for a motion then for.
Move to approve.
I'll second.
Okay, I believe it was Commissioner Aaron's and also Commissioner Landine, motion and second. Any discussion? Okay, call the roll, please.
Commissioner Aaron's,
Yes.
Poppins,
Yes.
Landine,
Yes.
Schmidt,
Yeah.
Gibbon.
Yes, thank you. All right. Item number 2, Mr. Floyd. Thank you.
Good morning, Commissioners. Terry Floyd, Highway Superintendent.
Thank you.
It's not like it's a private person.
This morning, I am presenting the 2025-2029 Highway and Bridge Road Improvement Plan. This is something we do every year. There is a public meeting, so we'll be taking input on this as well. And at the conclusion of this, I am looking for approval on this, because we'll need signature from the chair to sign off on this, and then we send this off to the state. So I'm gonna go through each year's funding and with the projects, the project lists. So I guess for 2025, starting, the first thing we have 3 preservation projects. And again, all these items are as part of my 2025 budget that I had sent off to you guys earlier here a couple of months ago. So we have a preservation project. The first structure up there, 4202201, that's on County Road 105, or Old Highway 17, just south of County Road 140. This is a preservation project, what we refer to as the Orange Bridge. That's got some bearing joints and such, so we're gonna have to redo the abutments on that structure. So next one is 42175-153. That one is the Beloit Bridge down here crossing the Big Sioux River. And that one we'll be doing end joints on that, expansion joints on the ends on those. And then the next structure, number 3 on the list for next year, is 42244-255. That is also a preservation project. That is the Hudson Bridge across the Big Sioux River.
Where's 3? It's-
Still following? That's a Hudson Bridge down across the Big Sioux River. That structure was constructed like 2006 or 8 or something like that. And we have to redo the abutment walls on that. We got some pretty severe damage going on that. But again, all 3 of those projects, we've been awarded preservation grants through the DOT, the big grant process. We're going to be hopefully going to bid on those here shortly for work being done next year. Number 4 on the list is 42152-170. This is number 4 is on County Road 134, which is just south of Canton, 285th Street, down by Highway 11 over there. Basically, we're doing a girder replacement, deck unit replacement on that one. And we also have 42166-150. We're also doing 2 deck unit replacements on that one. Basically, we're replacing 2 girders on that structure, and that's on a township road just south of Canton. Next one we have on there, number 6, is 42111-170. This is a newer structure. This is on 285th Street. We're going to be replacing this with a precast box culvert. And then the next one is 42086-170. And that one is also on County Road 134, 285th Street. And that one's going to be, I believe it's 4 set of pipe we're replacing on there. The next item on there is a really light colored line. Follows the line along 4, 6, and 7 right there. We're going to be doing full depth reclamation and base stabilization on those 7 miles. Then we'll be paving that ourselves. And then also for a project next year up north in the northern part of the county up there, we have County Road 105, 106, and part of 116, Parker Shortcut. We're going to be doing a micro mill on those and then a micro surface on those. So, any questions on 2025 projects? None? All right, 2026. All right, in 2026, we have 080-193. We're going to be applying for a PE grant for this structure. That is located on County Road 117, just north of 288th Street, County Road 140. And then we're also going to be applying for a PE grant for 42-172-240. And that's a bridge on County Road 148, so down by Lands Lutheran Church down there, so. Other projects for the year, we're gonna do a microsurfacing for 15 miles. That's gonna happen on County Road 152. This is to be the road that we had rebuilt here last year. We're gonna do a microsurface on that. Mill and overlay, we're gonna be going on County Road 124, from State Highway 115 to the interstate, about a couple miles in there, that we're gonna be doing a mill and overlay, and then we're gonna take 117 down to County Road 140 on that. The other project we have is, you'll see the circle, it's up on the north side of Lennox up there, on the very left side of the map. That's that intersection project that we're gonna be looking to do. And again, I'll be bringing that to you shortly to get approval to start on design on that. So again, that's in 2026. Any questions on projects in 2026? All right, 2027.
One minute. This Highway 17 and 116, is that going to be complete, turning lanes and the whole thing? And
So if you recall, back in May, we had IMA come in here and they presented the results of the study we had done there. And to get it so it does not fail in the next 25 years, the best option for that intersection is gonna be a roundabout.
Yes.
So,
Okay.
if you recall,
Yeah.
we tried multiple, lane configurations, all-way stops, and eventually it comes out to where it's gonna fail for level of service.
Okay,
So,
so that will be a roundabout.
that would be the plan,
Okay, good.
all right?
Thank you.
All right, 2027. We have a couple structures here, 42-010-265. This is on a township road, way down south. We're gonna do a federal removal grant on this one. Again, this is a grant that we received back in '23, or was it this year? Might have been this year. Where we had, we were applied for several structures. We have one that's this here, 010-265, that's gonna be a removal. Basically, the road has been closed for 20 years now. Nobody's using the bridge, we're just gonna tear the bridge out. Next structure on there, number 2, 42-120-158. That is on County Road 125, just south of Highway 18, about 2.5 miles. Again, that's a part of the federal replacement grant. And again, both of these structures, being they're part of the federal removal and replacement, are at zero cost. They're fully funded through the grant. Next one we have is 42 these are gonna be replacement projects. 42-120-283, this is on the south end of 125, north of Highway 46. And then we have 42-200-226 and 42-200-249. Both of those, number 3 and 4, or 4 and 5, excuse me, those are on County Road 139 gravel, down in the southeast part of the county. As far as other projects, we'll be having microsurfacing project in 2027. Again, that's going to be 117, 106, should be 110. Yeah, I'm too high there. Right there. Should be 110, 117, 111, and 102. Basically, that's the roads that we paved this year. And that's going to get a microsurface on it. So, mill and overlay for 2027 is going to be County Road 117. Basically, it's going for Highway 46 up to Highway 1, County Road 140. That's going to be 9 miles of that. And then we are planning in 2027 to have reconstruction of the ethanol plant road. Again, this here is something we're going to be hopefully applying for some federal money to get this project going. But this is where we're putting it in the project list, so. Questions on 2027? All right, 2028. All right, number one, 42080, 193, we're gonna apply for a replacement grant. Again, this is on County Road 117. Back in '26, we're gonna be applying for PE grants, and now we're applying for replacements. And the other one, 172, 240, that is, again, that's on County Road 148, just applying for replacements. Number three, we have a replacement. 050, 215. That is gonna be, right now, we're planning to do that. That's on County Road 111. And right now, we're planning to do that with county funds. Again, this is down by the dairy, down in the south, kind of the southwest part of the county. We get a lot of traffic on that road, and we're just thinking that the bridge itself is very narrow. So we're looking at possibly getting that thing replaced. So, full depth reclamation, we're gonna have, County Road 111 over there, and that's gonna be from Highway 18 south. We're gonna do 6 miles. And the reason that got put on the list this year is because, the dairy is, they're starting to reach further out where they can't pump their manure. And this spring, they hauled a lot, and that road took a beating. So we're looking at doing some, full depth reclamation and stabilization on that, so. Next project we have is a bunch of reseal work down south. You see all the solid green lines, that's gonna be a reseal project. We have quite a few miles that year. You'll notice we don't have a mill and overlay project because we have I think there's about 60 miles of reseal that we need to get done. So, questions on 2028? All right, 2029. 2029 replacements. So first of all, we have 42-160, 215 and 42-160, 227. Those are gonna be on township roads. Again, these structures are, the sufficiency ratings are fairly low on them, so we will be applying for grants at some point on these. But again, these are just some couple structures we want to throw on the plan, just so we have them on there in case something happens to them. That way we can get them up there, we can move them up in the plan if we have to earlier. The next structure is 42-030, 203, and again, this structure, number 3 on the map there. This is out in the southern part of the county. Again, this is just north of the dairy. I believe this is a limited structure, and I know that the dairy is hauling over this with loads. So this is, and again, this was a structure that we had on our plan probably about 4 years ago, but we ended up dropping it off because other structures came up a little more higher priority. So this one is back on the plan as well. Mill and overlay. We're going to be doing, basically we have a mill and overlay, must be down south. Is that 148? Mill 148 down there, we're going to be doing a mill and overlay on that in 29. And then also in 29, we're going to be doing a microsurface. Again, that's going to be on County Road 135 from Canton going all the way up to the north up here. So, all right. Any questions on 2029?
Terry, I just have a general question. I mean, it looks like, if my math's right, there's about $31 million over the next 5 years in the roads. I don't see anything, for like the roads over by Canton, like Southeastern or any of those roads. Has there been any looking at taking those roads over and doing some work there since, all of the work, it looks like, or at least about 90% of it looks like it's all taking place in the southern half of the county. I'm just wondering if anything's been looked at for the north half.
Well, the last 3 years, we've hit the north pretty hard.
Okay,
So if we go back and look at the last few years' plans, there's been a lot of work done up north. And we haven't hardly done anything down south. So, I guess as far as, you're talking about taking over township roads, we're trying to maintain what we have, and not take on any more. If that's something that you guys would be interested in doing, then conversations need to happen probably with townships, to start that ball rolling. And again, I think that, and I mentioned this probably 6 years ago when I first started, that there's probably 15 miles worth of township roads up north that probably could be taken over, but are we gonna have the money to do it? So,
Terry, a question I have is we had identified previously a couple of intersections that could use improvement via roundabouts, and I know due to lack of funding through the measure, we weren't able to do those. Are they not in your plan anywhere at this point to try to find?
at this point, no, they're not. The one intersection was Cliff Avenue and 106 up there. That is not in my plan, because I know that when we had done our study on it, we were proposing possibly doing a roundabout up there. That would fit in there well, but after several conversations with City of Sioux Falls, that does not fit into what their plan is for that intersection. So at this point, that intersection, I would probably end up just waiting until Sioux Falls comes down. And if we have to throw something into that pot to assist with that, then that so be it. But, and then the other intersection you're talking about is County Road 110, 117, and again, at this point, it's not on the plan. I mean, we can throw it back on the plan. I know that the one reason that this intersection that we're doing north of Lennox is on there, because this is one of them that's kind of called out in the master transportation plan, from 2019 as being, having some safety issues there. And again, I guess we went there, and I know the one on 110, 117 does as well. But again, I think at that intersection, we had pegged out to do a roundabout as well. And I know that, I haven't had conversations with the City of Harrisburg. I know they got some big dreams about doing some work, coming out west to the interstate. I guess before I'd put that on my plan, I would want to discuss with them if that's something that they feel would be in their project, or if they would be accepting of something like that.
Does
So,
the Klondike in 17 have a history of quite a few accidents?
I think there's quite a few up there, but there's a lot of near misses. So,
I know you did some work on 106 and 17 with new signs that lit up.
Yep.
Has that done what we needed it to do, in your opinion, or is there still work that needs to be done there?
I'm trying to remember when we put them up. I think we put them up about 2 years ago. There might have been one accident there since. I can't recall for sure. I would have to check for sure. But, like I said, I would think it would have helped. So the biggest problem, not really a problem, but we have with those is trying to keep them working. We gotta make sure that, because sometimes batteries die and then we gotta buy a new battery. I mean, it takes a little bit to get stuff in, but we try to have some stuff, materials on the shelf, supplies on the shelf to get out there and get them back up so they're flashing again type thing, but I believe they've helped. Like I said, I don't recall that I don't believe there's been another fatality at that one, so.
Terry, for those people who might be listening or just here, how do you come up with a numbering system for those projects? They're all 42 dash, so on and so forth. Is that something the state wants us to do, or how is that done?
So any of the numbers on this list that begin with 42, that's our bridge numbers. That's assigned bridge numbers for structures that we have that we're responsible for. And that comes through the state,
Okay.
they have them labeled out.
And then the next three numbers,
So all the numbers in that sequence, so 42 is our county number. Like on, if I just take example for 020, 201, so basically, when you come down in a line or come over in a line on the roads, that number, the lower that number, if that number like this one here is 020, that's 2 miles in off of the county line.
Oh,
And then, 201, the last three numbers is gonna be how far down it is from the north end of the county.
okay.
Does that make sense?
All right, that's interesting. Thank you.
So,
Any other questions for Mr. Floyd?
Yeah, Terry, good morning, and thanks for putting the plan together, and thanks for your team doing all this work. If you scroll to FY 2027 for me, at the top, it talks about county funds, 6.7 million, awarded grants, and then anticipated grants in the amount of 7.9 million. Is that for projects 1 and 2?
that will be for, projects 1, 2, and possibly the reconstruction.
Okay, so the reason just wanted to clarify that. So it'll be a grant to the county, but then that's why you've got them marked as zero cost, right?
The top two,
Yeah,
those are gonna be from the federal grant system, which, when we applied for them, there was zero cost to the county if you were awarded a grant.
okay,
That's just how the state had set that, process up for those. So,
so those 2 projects are not included in the 6.7 or the 7.9 million,
no,
correct?
no, because there's no county funding associated with them, so.
Okay, all right. So really in 27, we'll be doing about 13 or 14 million dollars in projects, is that right?
That would be correct.
Okay. And then, no, that clarifies for me. Thank you.
Because on the 3, 4, and 5, those bridge projects, we're looking to get, some, big grants for those. So that's anticipating grant funding for those, and then it's also anticipating grant money for the reconstruction, of that, ethanol plant road down there. So,
No, I appreciate it. I mean, what I'm trying to just get a handle on is, typically we run about $7 million
Want
a
me to
year
push the vote? Are you okay?
for your budget, and I was just trying to figure out here as we keep going through these outlying years where we're at on that.
Sure.
So,
Yep.
thank you.
Terry, one question. I do have to leave, unfortunately. What have we averaged over the last 5 years in county funds for projects similar to this? And expenditures?
it's similar to,
In a 5-year plan, at our county fund expenditures in the last 5, because we have 7 million. Is that obtainable with our current funding mechanism? That is what I'm trying to get at.
it depends. Again, a lot of that is dependent on grants. We're planning to get grants,
Sure.
and if the grants don't come in, the project is probably gonna be pushed down the road.
Yeah, I was kind of curious what
Yep.
our average of actual county expenditure, if you knew that off the top of your head on,
Yeah, I'd have to look back at that, Mike, and get back to you on that.
excuse me. Thank you.
Yep. Terry, are all our grants federal grants, or are they state grants, or?
No, typically, anything we get is a state grant. It's gonna
Okay.
be through the Bridge Improvement Program, and that's through the South Dakota DOT. So on this project here, this is the one I'd be looking at doing a federal grant, and this is gonna be under the Safe Streets for All program, as part of that bipartisan infrastructure law that they passed, 22, was it? So I know right now, we're in the process of selecting consultants for doing our comprehensive safety plan, safety action plan. So this is something we need to get done in order to apply for implementation or a build grant. So the hope is we'll be done in time in '26 with this plan that we're doing, the safety action plan, where then I can take and turn around and I can apply for construction money on this, for this project here, so.
Terry, what's the progress out there on 135 going past Lake Alvin?
So right now, that project, the road is open, project is complete. And again, I'm working with the state again as well for emergency funding. We're gonna be looking at doing some mitigation work there to possibly add culverts or change the structure type to hopefully alleviate it from topping the road again. So, and I know that's all. I haven't heard anything from the DOT here for a couple of weeks now, after I sent them some cost estimates that they were requesting, so, we're still waiting to hear back what that possible structure could be. I mean, maybe it's gonna be a bridge, maybe it's gonna be a big box culvert, we don't know. So,
And I assume because we're waiting on the state funding piece to kind of inform us as how things go, that could slide into one of, is that your thought process, is that it slides into one of these out fiscal years?
correct,
Okay.
yes, yep.
All right.
Yeah, and again, I know that, and that's gonna be an 80-20 share on that cost share doing that. So whenever that comes up, and I know that they're trying to be quick to try to put numbers together so they can put their request into the feds, for money. And then once they find out if they get it, then we'll start doing, preliminary engineering on that site, to see what we would need there for a structure. And then, of course, after that, we'd get cost estimates, start doing design, go to bid. So hopefully that would be all, it's possible it could be, I don't foresee it being in 25 yet, but it could possibly pop up in 26.
Thank you.
So,
Terry, this money, we talk about grants, does that come from the federal gasoline tax, majority of it? Or where does that money come from that the feds or the
Well,
state has to?
You said, yeah, state, but where do they
Did
get it
So-
from?
you have a federal gas tax and? is
so
that where that
back
comes-
back in 2015, I believe it was, if you remember back that far, and you can just Google this, Senate Bill 1, I believe it was, it changed the format for how funding and what the state set aside for some of the funding money they get from counties
Yeah.
for this bridge improvement program.
But I mean, your money that comes, federal gas tax gets filtered down somewhere to states, right?
Yeah, I'd have to look into that, Jim. I'm not exactly sure on that. I'm sure it does. You know, but any federal money we apply for comes directly from the feds. I
Yeah.
mean, like this Safe Streets for All, that's coming directly from the feds.
Well, I
So-
read once, where, the gas tax was X, Y, and Z, but the amount of money, because of the efficiency of cars today, better mileage, electric cars, everything, that funding source wasn't growing necessarily, it was capped or declining, and, in the long run, rubber hits the road right down here in Lincoln County, so that makes it more difficult for you to maintain the road grid you have now.
Yeah.
Yeah.
And I will say that, the state is, they've finessed, the formula for the funds that they are using to put into, for the bridge improvement program. And I know that the last several years, they've gotten a lot of federal money, just because of all the federal programs that have come down probably the last 4 or 5 years. And I think some of that money, they're even putting that into the big programs, so we have more dollars in there, for counties and cities to draw off of on that. But, even at that, I mean, typically every year when you do grant requests, I mean, you're getting, $150 million worth of projects, and you have, $40 million to give away.
Yeah.
I mean,
Terry,
there's
it's
just,
harvest this season. Are all our county road bridges and so forth operational and so forth? I mean,
right now, we have one that's still closed.
and which one's that?
That is on County Road 106, west of T over there. It's about a half a mile east of the county line.
Okay.
But with any luck, hopefully that'll be this week or next week, that'll be open. And again, that one, and another structure was part of the 2020 federal grant program, where we received funding for. So the one down south is already complete. That one's open. So we're just waiting on this one, so.
Okay, before I ask for board action, is there any public input on the plan presented by Terry? Yes, come on up to the podium, state your name and address.
Mark Sexer with Springdale Township Supervisor, 27127 479th Avenue, Harrisburg. And just want to bring up something that was touched on a little bit ago, and that's turning a township road into a county road, if that's possible. If so, how do we go about looking into that? We're looking in particular at Sycamore between Harrisburg and Sioux Falls. That thing just gets a ton of traffic and,
Is that your territory, Commissioner Aaron's?
Yeah.
Okay. Terry, do you have any input on that? Or,
So yesterday I had a fairly good conversation with Mark about this. And I think this is something that, that we as a county, you guys as a board, you need to decide if this is something you're open to doing, right? And if you do, there's a process I believe we could follow to do it. But again, you're just gonna have to make sure that it's funded to be able to take this over, make sure that we can afford to do this.
And Terry, what would we need to do as far as, if we were gonna look at doing something like that to get like an initial, cost? I mean, or do you just have that, it's so much per mile?
So I know several years ago, and this is probably 5 years ago, I had IMEG work up something just very rough. And again, not taking care of drainage, not doing any more additional right-of-way, because these are gonna be 66-foot statutory right-of-way roads. You're looking about $1 million a mile to do something to.
That's what I
you know.
remember.
And then, so if you're gonna be doing drainage, buying right-of-way easements, we're probably looking $1.5 million a mile to rebuild this.
and how long, what is the length then of this?
I think what Mark was talking about, I think he was looking, let me see, it's gonna be 1, 2, probably almost 3 miles-ish, 2.5 miles. So, because on the north end, what is that, below, was that 69th Street? 69th Street, they came down with the new school, right? Correct? Yeah, yep. And then, so they came down with Harrisburg has a new school out there. I
Yeah.
think the city came down and built that down to that school. So you have probably about 2.5, or half a mile there down to 85th Street, and then you have another mile down to 106. And then going south of 106, you have a mile, because I think Harrisburg is gonna come up to 272nd, I believe, this year? This year?
Yes.
So, so basically you'd have probably about 2.5 miles in there. So,
So we're looking at, 2.5 to 3 miles.
Yeah.
At $1.5 million a mile.
yeah. And I think once this, we open this box, I think we're gonna have multiple roads. And again, I think back probably 5 years ago, I identified probably about 12 miles worth of road up there that could possibly be turned over, Now, some of these, they're close to municipalities, whether it be, T, Harrisburg, or Sioux Falls. Do we need to do something? I don't know. And again, this is another conversation that probably needs to happen in collaboration with the city of Sioux Falls, especially on something up north there. Maybe we don't need to spend that kind of money. Maybe we just blade out what's there, don't do anything, and just put a mat on the road and hope for the best. Until they come down and they do their thing, right? So, that maybe that wouldn't cost as much, but you're probably still looking $750,000 just to pave it. Doing some
Okay.
base
What-
work. So-
I'm sorry, go ahead.
Nope, I'm done.
what kind of burden, or would it be too onerous to take those roads over even if they were gonna remain gravel till we figured something out?
The biggest part would be for us is maintaining them, getting a motor grader up there to do it. Just since it's, I mean, we don't have anything up that way. All of our gravels are, we go about 2 miles north of town here, and that's 3 miles north.
Right.
That's kind of about it, and the rest of them are down south,
All right,
so.
thank you.
Terry, when you talk about blading and matting, I get it. And maybe this is a question for Mark. Do they currently do any kind of road hardening up there or anything, or?
Yeah, I talked to Mark yesterday, and then on their segment, they did do some base stabilization in it a couple years ago. And then they also, I believe they mag water it every year, just once a year, twice? Twice a year, they mag water it to try to keep it held together, keep it binding together. So,
Well, I do think this is a conversation we should have in collaboration with Sioux Falls too. But your suggestion of a mat or something of some type might be the first thing we could possibly do.
and again, I mean, again, I would, I mean, if we're gonna do this, I would, like I said, I would get
Okay,
Sioux Falls involved, possibly the city of Harrisburg on the South Mile, just so we don't do anything in there that, you know, we're gonna be spending a bunch of money on it, and then they have plans to come down there 2 years, 3 years later and rip it all out, you know, type thing. I mean, so, and again, that's why I said maybe the best option is just gonna be putting a 5-inch mat on it. You
okay,
know, blade it out, do some base work, put a 5-inch mat on it and hope for the best, but, you know, the thing is when doing this, we're not gonna, you know, trying to think of safety, we're not gonna have, you know, your 4-to-1 slope, it's gonna be a sharp drop off, you're not gonna have shoulders on it, it's gonna be kinda like it is now. I mean, I know the road is fairly wide right now, just because the traffic has widened it out. I mean, but it'd be tough to have shoulders out there and
okay,
in any kind of ditch, so.
thank you. Mark, do you have any other comments, or come on up to the mic?
So I guess my only question would be then, what's the next step, or how can we set up some sort of a meeting, or who does that, or? where do
We
go?
would work with Terry and
Okay.
maybe with some collaboration with you as a township, and maybe we can go forward and see what, step by step, what we maybe could try to do
Sure.
with Sioux Falls and so forth,
Okay.
in here, city of Harrisburg.
I think, would it be Shannon Austin? Would she be the person to talk to from Sioux Falls? I mean, I'd be happy to meet with you and Shannon and see what their plans look like for that area, if that's on their list of to-dos.
Yeah,
So,
Commissioner
yeah.
Aaron's, you're,
Mark, I think
Probably
you
have
guys
talked
have
to the
done an
people in Harrisburg
incredible
already,
job
haven't you?
maintaining that road. I
Thank
really
you.
do. The amount
Thanks.
of traffic that you have on there
Yeah.
and the mag water that you poured in there, you've made it kind of a half blacktop right now, but I've been on the road, but I think townships are not easy, but that one there, I can understand why you'd like to absolve yourself of that responsibility.
Thank you.
Yeah,
Thank you.
Mr. Chairman, to answer your question there, I've talked to the folks in Harrisburg about this. I mean, they've gone as far north as what they've intended to go and as what they believe their budget will allow them to go. I have talked to the folks in Sioux Falls. I'll just say you're probably not gonna get the answer from them that you want. We could sit down and talk to them, and I'm anticipating they're gonna tell you the same thing they told me. But maybe by having a meeting with them, it reinforces the belief. But Sioux Falls is a big ship, and it takes a lot of steam in order to push it one way or the other.
Who did you talk to over there?
I talked, it was a guy, is his name, Heath or something with an H, I don't know.
Okay.
City engineer?
Yeah,
Okay.
yeah, I want to say his name is Heath. Is that somebody in their office there, Terry?
Well, yeah.
typically he does like signal work,
Oh, okay,
so.
yeah. Maybe he's not the right guy then.
Well, I think if you would do that, Commissioner Landine, I think that would be,
Yep, I'm
that's
happy
good.
to do that.
yeah.
Get the ball rolling.
Okay, thank you. I guess, notice Terry's asking for board action, so can I
Move
entertain
for
a
approval,
motion?
Mr. Chair.
I'll second.
Okay, motion by Schmidt, second by Landine. Is there any discussion? If not, call the roll, please.
Commissioner Aaron's,
Yes.
Landine.
Yes.
Schmidt,
Yes.
Gibbon.
Yes, motion carried. Next, item number 3, notice Terry is also asking for board action to approve a change order for a structure 42007-040 in the amount of $29,545. Terry?
All right, so this here is a change order for structure 42007-040. Again, this is a structure on 272nd County Road 106 west of T out there that I was just telling you about, that hopefully this one will be open soon. Once the structure was built, they had it in place. We went out there and looked at it, and we just didn't feel that the riprap went around the bank enough to protect that bank from being washed out and cutting on a high water flow. So, and the state agreed, and the state has already approved this as a change order. And again, this is gonna be a full cost to us, but this here, it'll fall within my budget to do this for that project anyway. So I have budgeted money for this, so.
Okay, any questions for Terry? Any public input on this matter? Okay, if not, I guess I'll entertain a motion.
Move to approve.
We have a motion by Landine, is there a second?
Second.
Actually, it was
Second by
Aaron's.
Schmidt? Okay, is there any discussion?
The motion was Aaron's, not me.
I'm sorry,
Yes.
you get it? All right. Any discussion? Okay, call the roll, please.
Commissioner Aaron's,
Yes.
Landine,
Yes.
Schmidt,
Yes.
Gibbon.
Yes, motion carried. Thank you. Next, Jared?
Since you're all questioned out,
You hope.
I hope. Jared Narum, Assistant Highway Superintendent. So back in June in the flood, our Fairview pit got flooded out and we lost our 2006 950 loader. They ended up pulling 10 gallons of water out of the crankcase, a couple gallons out of the transmission. So we had Butler Cat do an extensive evaluation of the machine. They came back with a kind of a cost on what it would take to fix it, and it was around $147,000 to fix that machine to bring it back. That's wiring harnesses, all that. The water got about 10 inches to a foot high in the cab of it, if that says anything. So we got back, so then dealing with Butler, then dealing with the EMC insurance, we ended up finding, coming to the insurance gave us an estimate of what they're gonna pay for what the machine was worth, and that was $87,900 and some dollars. During that time, I had reached out to Butler Cat to kind of see what their cost was, what that machine would be worth if it hadn't been flooded. And they got back to me and it was around $90,000. So I believe what we're getting through insurance on that machine and what it was worth to the dealership is pretty close. Also with that, we're renting a machine currently to take this one's place at a cost of about $10,000 a month. Through EMC insurance, we also did get a $5,000 reimbursal for rental. That was the max that the insurance company would pay for that. So in turn, and essentially, we're getting about $90,000 back through EMC. Working with the dealer, trying to find loaders, which there's not a whole lot out there. We did come and find a loader for the amount of $350,000, $350,2173 for a loader. Now, this is a non-budget item. This isn't in our budget. We don't have the money.
Neither's the rental fee though, is it?
No. No.
You couldn't find any, this is a new,
This is a new unit. We also looked at the unit that we're currently renting right now, trying to recoup some of that rental money that we have been using to bring it in.
sure.
One, they don't want to get rid of that loader off of their rental unit because it's not like they have a lot of loaders sitting around.
Moneymaker.
It's a moneymaker, yes. But CAT is running an incentive on their new loaders now, and I know that $350 sounds like a lot of money, and it is, just like everything. I think in 2015, we bought our last loader, and that was $240,000 in 2015. So 9 years later, here we are, look at the cost increases we have. That does come with a 7-year warranty, though. All filters, all that stuff is completely covered by CAT for the first 7 years. So when you look at taking the roughly $85,000 that you get from the insurance on our loader, we're looking at probably another $45,000 higher than what we paid for our loader back in 15.
And is that the same loader we just surplused? In our
Well, it's
consent?
same size, yes.
Okay.
Yeah, same size.
Okay, and what size is that then?
It's a 950M. The one that we surplus is a 950H. This one is a 950M that we're looking at purchasing.
Jared, these
Office
things
or
run
so.
for how long? I mean, how long do you run these things?
Well, like this, like our last one, it went for 18 years.
Yeah.
I mean, so if we're looking to go down the avenue of used, they have one used loader in their market right now that is $220,000 on a 4-year-old machine with 4,000 hours. Emissions on these things, please give me the warranty. You know, you start getting into the, trucks are the same way. You get into these trucks that got high miles, you get higher, hours on equipment, the emission systems will nickel and dime you. It's just a fact of the game.
The old one we just had sitting there, and did it get covered with water completely, or?
Yeah, the Big Sioux River backed up and it crossed the railroad tracks down there and went into our pit. I mean, 14 wasn't even that bad. So,
Okay, I guess, any other questions the commission has? Is there any public input on this matter? Okay, seeing none, Jared is asking for board action, I guess.
I'll move to approve.
I'll second.
Motion by Landine, second by Schmidt to approve. Is there any discussion?
Well, when you factor in, sure, there's a lot of money up front, but when you start adding that you're gonna keep this thing for 15 to 18 years, then you put down, and you got it covered for, 7 years of its life?
yep,
It makes sense. You get what you pay for
yep.
in life to life, so.
Is the warranty based on the hours used or just the
Well,
length?
yeah, so it's 84 months or 3,000 hours, whichever comes first.
Okay, all right. Any other discussion? Okay, Alicia, call the roll then.
Commissioner Aaron's,
Yes.
Landine,
Yes.
Schmidt,
Yes.
Gibbon.
Yes, motion
you.
carried. Thank you, Jared. Next, Tracy?
Good morning, Commissioners. Tracy Humphrey, your HR Director. So I'm going to have Sean Arnett, he's our broker for our insurance, to come and speak about our renewal for 2025.
Thank you, Tracy. Morning, Commissioners. Great to see you all
Morning.
again. So I'm going to be speaking, just like in previous years, to the 2025 renewal for your health insurance plans. As we have with past years, I'm going to do a couple quick slides, let you know how your plan did run and how it is currently running, which then will lead into the renewal. I probably will not go through every slide. I know you have this deck, but I do want to point out a few things here. So with your Health Partners fully insured medical plan, we are looking currently data January through July, so 7 months of the current plan year. And some of the key things on this right now is that blue is your current year to date. And we look at this loss ratio down here, and strictly what that is the premiums to claims paid for Health Partners. So through the first 7 months, Health Partners has paid more out, $1.2 million than they've taken in premiums from Lincoln County. So loss ratio is 110%. Last year, you ended at 116%. So again, last year, we knew that was running. When I was here last year at this time, the beginning of the plan year last year was running well, but we knew the claims were starting to trickle up. Working with Tracy, we knew those claims were going to continue, and that led into the reason why we had two alternates for a renewal last year. One was a flat renewal. One was one that provided a rate cap at a 3%. Knowing that the rate or the loss ratio was increasing, you all chose to keep that rate cap, and we'll look at that here in the renewal in a minute. So it is running what we call a little bit of a temperature again. You're just not running to expected, it's running over expected. Your enrollment on the plan has increased. The blue here is your 2023 and the dark blue is the 2024. I looked down at the last quarter of last year where total contracts, you were in the high 80s, where this year you've been in the 90s and actually tripping up now to almost just under 100. Okay, so on a per contract basis, you're up about 10.8%, members 10%. When we look at each plan separately, your copay plan is up about 13% in enrollment, and your high deductible health plan is up just under 4%. When we look at the claims, again, you are just paying premiums, but we need to know how the plan is running, what Health Partners is paying, because that's going to what leads into your renewal. So last year at this time, last year of 2023, you were averaging about $158,000 per month in claims paid. This year, for the first 7 months, it's about $176,000. When we look at that wider, though, risk pool you have more enrollment. So this PEPM, which means per employee per month, the claims are actually only up 0.3%. So the plan through the first 7 months, averaging is doing well, but you can see in the first couple months of the plan year this year, you had some high claimants, some high utilization. Then again here in May, which you'll see in a second what's driving the renewal. Okay. You're a smaller size group, so you're not statistically credible, but we like to measure your own trend to see where it's at. So real quick, what this chart's showing is each blue line is the actual paid claims in a month. This red line, that red diamond, is an average of the prior 12 months. So I'll call that your trend. So when we look back at August 2023, your average rolling 12 paid claims was 162,000. It's now 178. So the claims increased about 10.2% over that rolling 12 time. Anytime one of those blue bars are above the trend line, it's going to bring that trend up. You can see February, March, April, May started coming down, brings that trend line down. But again, as I mentioned, those first couple months kind of drove that up. Dental is running really well. It's very secular. You'll notice when we get times of kids going back to school, the start of a plan year, and of course the end of a plan year, you'll see dental claims going up. But right now, your per employee per month dental costs, the premiums have gone up 3.5%, which is driven by enrollment. When we wrap this up, just kind of in a totalitarian way for you all, again, you're fully insured, you're not paying claims, but we look at through July, Lincoln County is putting about $836,000, employee contributions about $275,000, so that's $1.1 million. Since you're fully insured, that's the amount you pay Health Partners. But if we take that employee contributions out from that $1.1 million, again, that net cost to Lincoln County has been $836,000, or a per employee per month cost of $1,244.42, which is up about 5% from last year. That is simply driven on the higher enrollment you have. Because you're fully insured, that's driving that increase in per employee per month. Okay? So that leads us into your renewal. But real quick, couple things. So this is your plan design. So when we speak about the plan design, and when I say this, I'm talking about the overall plan design. So the deductibles, the out-of-pockets, the co-pays, and the co-insurances, not anything specific. The core of the plan designs are remaining the same. So on the left here, the co-pay plan, the deductibles, the out-of-pockets, the co-pays, the co-insurance, nothing is changing, okay? Over on the HDHP plan, for the most part, that's true as well, but similar to last year and what happens every year, is the deductible will be increasing. So the single will go from $3,200 up to $3,300. The family will go up from 64 to 66. This is simply an IRS indexing when you have an HSA plan, a high deductible health plan. To remain embedded, there's a minimum you have to have. And every year the IRS indexes that up. So in order to remain embedded, that has to increase, similar as last year. The other change you'll see down here in red is to the Virtual. So that's the online screening. It will go from a no charge on the high deductible health plan to deductible co-insurance like everything else. And I'll talk about that in a couple slides here. Okay, that's really a mandated change. The prescription drugs, again, just talking about the structure, not drug specific, the co-pays are remaining the same on both plans. There are no changes to those plans. Okay. Real quick, just new this year for you all, I did throw out a slide. I do work with Tracy and HR each year to do a benchmarking of your plan. And what we do is we compare it to other similar size industries and regions. So for this, we looked at the upper Midwest, employer size 100 to 499, public administration. And really what this is showing, if you're a baseball fan, this is your strike zone. And so this left chart here is just looking at your medical benefits. So this axis here is the plan design. The higher up, the stronger the plan design. This axis here is the employee cost sharing. The further to the right, the lower the employee premium. Plans want to remain in this strike zone, that blue area. And you can see your combined medical plans are right in there, market competitive. Now, when we move to the right, now we're looking at the bottom axis here is your medical plan assessment, but the side is all your other benefits, your dental, your vision, and your ancillary, your whole portfolio. And again, you're right there in the benchmark. Both of those are being market competitive. Okay? All right. So I mentioned there are some plan changes. So as a fully insured plan, every carrier every year is going to have either some kind of language change, policy change to their plans, or there's going to be governmental changes. So these are the three that Health Partners provided for us for your plan that are going to be changes. So the first one I mentioned up in that plan design, I showed you that Virtual on the HDHP plan is moving from no charge to deductible co-insurance. That's simply because the pandemic, we had a safe harbor. And during that time frame, that emergency relief, the government allowed high deductible health plans to have a no cost for e-services. That safe harbor has ended, so as of 1/1/25, Virtual has to be treated just like any other benefit in a high deductible health plan, deductible co-insurance. You can't have first dollar payment. The next two go hand in hand. And this is interesting because it's actually part of the Mental Health Parity Act, but these benefits have nothing to do with the mental health. It's how the mental health benefits and other benefits align with each other. Part of the act is they can be no better, no worse. So because of that, as of 1/1/25, medical injectables in the office, other than routine immunizations, will be going on your copay plan basically from a copayment of $2 to deductible coinsurance. Okay? That's not a Health Partners change per se, that's a change that has to be made to remain compliant with the Mental Health Parity Act. Okay? This could be allergies. This could be any kind of shot you receive in the office for chemotherapies. Any injectable done in the office. The second one, and that'll affect your copay plan, it will not affect your HDHP plan because that's already deductible coinsurance. The second one down there is the orally administered chemotherapy drugs. So currently, your coverage for these drugs will be dependent upon what level they are in your pharmacy plan. So a tier 1, tier 2, tier 3, or specialty. 1/1/25, it actually follows the medical injectable benefit, except coverage will be automatically changed to just coinsurance. Deductible will not apply. Okay, again, these are mandated changes, not changes that were requested or asked for the plan. Now, we did ask Health Partners how that will be notified to employees. So once your plan is confirmed renewed with Health Partners, they will then send out notices to any member that's affected by these two benefits, the medical injectable or the orally administered chemotherapy. They couldn't give us a date exact, just within a month of plan confirmation. Any member that has had claims for these will receive a letter specifically letting them know that the plan will be changing as of 1/1/25. Okay? All right. One thing that we do too, even though you're a fully insured plan, we underwrite your plan to the point of we want to make sure when we get the renewal, it kind of jives with what our numbers would say as well. And so I'm not going to go through the entire slide here, but what we do is we look at your last 3 full plan years, we underwrite them and then trend them forward to midpoint of next year. So we try to say, these claims that were in 2021, what would those claims be in 2025? Same for 2022 and same for 2023. We then weight each individual plan year. We say what claims should have happened but didn't, what claims happened but on average wouldn't. So we normalize it. At the end of the day, looking at your last 3 plan years, our analytics would say you'd probably be getting about a 12.5% increase at the minimum. Okay, that's with trend, that's with no plan design changes, and that's just moving it forward. However, as I mentioned earlier, and many of you know from last year, we had 2 options last year during renewal. Remember, with Health Partners, we could have had a flat renewal, and then this year just be open. Or we could have chose the option which you did approve, which is the 3% increase, but it was capped at a not to exceed 7% this year. Again, our recommendation, which you approved at that time, was take that because we knew the claims were starting to trend higher. Again, our underwriting on that previous slide shows you probably would have been in the double digits. Good news is though, because you did approve that option, so this year your rates came in on the copay plan at a 6.96% increase and the HDHP to 6.84, so a combined 6.94% increase. Slightly lower than medical trend. Okay. If we take that 694, the 6.94, and carry it through the contributions, so on the left in the blue are your current plan year, and here in the orange would be your new plan. So I'll look at the top here, which is our copay plan. And so for example, an employee's cost would go from $199.86 over to $213.76. Over to the right, that's a 6.96% increase, and you can see per month, it'd be $13.90 up to a family of $49.12. The second rows here are for the HDHP plan. So employees' costs would go up $10.72 per month up to a family of $37.94 per month. These are per month and these are pre-tax, so they'd be a little less than that. If every employee stayed in the same plan, in the same coverage tier, which they won't, but if they do, we have to compare apples to apples. The projected cost for 2025 to Lincoln County is right here, the $98,609 or 6.95%. Okay. So any question on the medical before I move on to the dental?
Any questions? Okay,
Okay.
move on.
Dental's pretty straightforward. It is a 4% increase. The interesting thing here is when we calculate the experience needs, in other words, when we look at your dental plan with Delta Dental and say this is the need based on your claims, it's actually a 25.6% increase. Delta Dental of South Dakota has a fantastic program in South Dakota. The longer you've been a client with them, they cap your renewal at a certain number. Your cap is that 4%. So that's what will carry over to next year. No plan design changes. Plan still has the prevention pays, the health through oral wellness, and the maximum bonus account, which allows a carryover. This is completely employee funded. So that 4% increase to an employee would be about $1.88 per month, up to a family of $5.80 per month. Okay. Vision. Last year we re-renewed with IMED for a 4-year rate lock guarantee, so there are no changes to those rates or the plans. So of course, the employee cost remains at 0, or the increase. We also moved to Symetra for your base life and accidental death and dismemberment, along with some other voluntary benefits. That's also under a rate lock, so there are no changes to these rates. They're good through 2026. So again, based on current volumes as of September 2024, we estimate the cost to Lincoln County for the base life and AD&D at about $3,100. If we wrap all these up and kind of look at it from all benefits provided by the employer. Notice I'm not showing voluntary benefits. There are no changes to rates or plan designs in the voluntaries. But when it comes to those plans that have, they're either core or have some involvement from a payment from Lincoln County, we look at medical, dental, vision, and there's that base life and AD&D. So down here at the bottom are the projected annual county costs. So medical really is the only thing that you would see that increase at 6.95%. There is no increase in the base life AD&D. Again, the dental and vision do not have any Lincoln County costs. So total cost to the county for those 4 plans projected about $98,609 or 6.93%. The last thing on the renewal is, one thing we were asked is currently today your health savings account, the bank account portion of it is administered by Optum. That came about when you were all with United Healthcare and an HSA was put in. The request was asked to move that administration over to Task. Task is your current flexible spending account carrier. So we did receive a proposal for that. Moving that over to Task would save the county because right now the county is paying for the administration of that. With Task, there is no cost. The other part of that request from HR was to move COBRA service, so COBRA administration, over to Task as well. So currently, COBRA administration, when an employee with a medical, dental, or vision plan leaves the county, you have to provide them COBRA continuation. There is specific legalities around when that paperwork has to be sent out to the employee, how that has to be processed. So to take that liability off of the county, since you're doing that in-house, the request was to move that COBRA administration to Task as well.
Okay.
Any questions?
Any questions? I guess, Tracy?
Yeah. Thanks, Sean. So as the resolution lists there is for requested action, I'll just recap a couple of those. Is that, like Sean said, we're asking to move for you guys to approve the health insurance increase and the dental insurance and accept both of those. Also asking to end coverage with Optum Health to switch to Task, which will result in about a $200 a year cost savings to the county. Adding Task as the county COBRA administrator. I currently have funds in my professional fees budget to cover that cost, so there would not be any necessary increase to the budget. The one item that is also being asked of the board that Sean did not go over is the request to end payroll deductions with AFLAC effective of January 1st, 2025. So it's a somewhat separate issue or but also similar. HR is requesting to end payroll deductions with AFLAC. Currently, and it's under the facts and vetting under 3.3 under staff recommended changes. With the increase of our available benefits to our staff, so Symetra, we brought on last year and added a couple of different ancillary benefits. As a result, the county is now offering most of the same product that AFLAC does. And allowing AFLAC actually can result in competition against ourselves and could result in potential conflict as we look to renewal costs in 2026. So under Symetra, since it is a county administrative benefit, we can negotiate lower rates and look at different plan options, whereas AFLAC is independent. So HR, we're not able to discuss plan design or help our employees in any way in that regard. Additionally, when looking at risk and liability, Symetra only offers post-tax benefits that ensures that regardless of the level of coverage, we always should be in compliance with the IRS. AFLAC does pre and post-tax offerings, and again, they're professional, they know what they're doing, but there just always is a liability there. So the good thing though is staff would be able to still keep their AFLAC coverage. We're not telling staff that they can't. We're just saying that the county is no longer going to take those deductions. And I did confirm there is no additional cost for our staff to keep their benefit directly through AFLAC. So they would just port it, work directly with that representative if they want to, but that way the county's benefit plans are very cohesive and hopefully encourage people to be a part of those benefits as well. So that's the additional ask that HR is asking for the commission, and happy to answer any questions.
Madam Auditor, do you have any input on this?
Tracy has talked to me about it, and I agree with the request that she's making.
And this was in our budget?
There will,
No budget.
No
it will,
budget.
like, removing the Aflac doesn't affect our budget.
No, okay.
The rest of it, yeah, we have the 7% in for the health insurance. All that's been discussed way back in the budget process, so.
Okay. Is there any public input on this matter? Okay, notice we're asking for possible board action, but I will entertain a motion.
So move, Mr. Chair, on the request from HR to no longer take the deductions. That's their responsibility with Aflac, if I understand.
say that you're moving on the requested action on the briefing form?
Yeah,
Couldn't have said it any better.
Thank you. With that, I'll second
All
the
right.
motion.
Is there a second? I guess hearing none, the motion dies. Notice this is possible board action, so.
I'm sorry, I did second the motion.
You did second the
I
motion?
did.
Okay, all right. We have a motion by Schmidt and a second by Landine. Any discussion?
Mr. Chairman.
Yes.
Tracy, I have a question.
Certainly.
Why do we need to pay Optum to do the Cobra administration? Why can't we just do that ourselves?
certainly. So right now, we're projecting that it would be a $600 a year cost. Right now, to do the Cobra paperwork, you're talking about for every employee that leaves, HR probably spends about 20 to 30 minutes per employee when we have an average of anywhere from 20 to 30 employees that leave. So that's our time, as well as currently, any payments for Cobra have to go to the auditor's office. The auditor's office then has to record those funds and turn around and generate a check to the insurance providers. So that's their time as well. That combined with the liability of being covered of saying, hey, just in case, obviously we have a process, but in case something were to happen, anything get delayed and there be a problem, all of the liability is now on task rather than the county. So we don't have to worry about if there was going to be any issues and any legal actions thereafter. So the time management plus the liability felt like a good proposal with them.
Thank you.
Certainly.
Thank you. Any other questions? Okay, we have a motion and a second. No further discussion. Alicia, call roll.
Commissioner Aaron's,
Yes.
Landine,
Yes.
Schmidt,
Yes.
Gibbon.
Yes, motion carries. Next, employee handbook.
Thank you. All right, again, Tracy Humphrey, your HR director. So as we're approaching the 1 year of our extended sick leave and paid time off program, I realized there was a gap in the language that I wrote for your policy last year. And so it's necessary to clarify some of that language. Just to familiarize you with it, is that our extended sick leave requires that an employee has a waiting period of 24 hours before they're allowed to use their extended sick leave. This is mirrored after our the other PTO and ESL programs in the state. So we wanted to clarify with our individuals who have long-term Family Medical Leave Act approved illnesses. So there's a good broad spectrum of that, and we have a very thorough policy on what that looks like. But currently, with that 24-hour waiting period, the question before you is if you want to require that every year employees have to do a new waiting period of 24 hours of PTO, or if we want to waive that waiting period if the FMLA situation is stayed the same. So I listed two options here of language. Option one is that we're not going to require an additional waiting period. I'll just jump down to the part in bold that says FMLA approved situations that are recertified annually will not require a new 24-hour waiting period at the time of recertification, as long as there's no gap in the FMLA coverage and the nature of the type of leave does not change. So the idea here is, let's say we have an individual who has a serious health condition. They have to go to the doctor 3 times a year and sometimes may have some flare-ups where they have to miss a day or two of work. They go through the medical certification process. I review that. If I have concerns, I always talk to our legal team and I approve them for FMLA for a year. Coming to the next year, they still have to do that same level of paperwork. I get re-medical certification. But the question with this option, we're not requiring them to use 24 hours of PTO before they can use their extended sick leave. We're saying, hey, if your condition has stayed exactly the same and the nature of your leave has stayed and you have not had any gap in your FMLA coverage, then we're not going to require you to do a new waiting period. Option 2 is, I'll read again in bold, it just says that FMLA approved situations that are recertified annually will require a new 24-hour waiting period to utilize ESL. Under this option is saying, yes, same situation, you have a chronic condition, you're going to probably have it for the rest of your life. We do the same process with FMLA. However, you are required to use 24 hours of PTO or comp time or unpaid leave before you can access your ESL. And that's just I was explaining to someone earlier, there's one that's maybe a more employee-friendly option, one that's more rule-friendly. But either way, this just wanted to clarify for our employees what they expect if they do have a serious health condition that goes year after year. To be clear, I just want to say that it does not affect their FMLA qualification. That is a separate process that we follow per federal guidelines. This is just talking about their leave benefit and if they have to use PTO before they can access their extended sick leave.
Any questions? Okay,
So Tracy, this is just merely a either or. You've filled it out once, same situation that caused you to have to fill it out would exist the second year, so you don't have to go through the 24-hour and reapply, right?
Yep, that's what option 1 is, yes.
yes, all right. Any other questions? All right, is there any public input on this matter? Okay, I guess I'll entertain a motion.
Move to approve option 1.
I'll second.
Okay, there's a motion by Aaron's and a second by Landine to approve option 1. Is there any discussion? Not, call the roll, please.
Commissioner Aaron's,
Yes.
Landine,
Yes.
Schmidt,
Yes.
Gibbon.
Yes, motion carried.
Thank you.
Next, Madam Auditor?
So the next 3 items, it's a 3-step process, I guess you could say. The first thing we're going to do is the board action to approve South Dakota Public Assurance Alliance as the county's property and liability coverage carrier and authorize the chair to execute an agreement with the alliance.
Okay, you're looking for board action, so I guess I'll ask for any questions that you may have for the auditor. If not, is there any public input? Okay, then I'll entertain a motion.
I'll move to approve.
We have a motion by Landine and a second by Aaron's. Any discussion? Okay, call the roll, please.
Commissioner Aaron's,
Yes.
Landine,
Yes.
Schmidt,
Yeah.
Gibbon.
Yes, motion carried.
Okay,
Next, we're going to item
so
board
now we're
action
actually going to
regarding
item 9.
retroactive coverage, correct?
Yep, we're going to item 9, since we switched that around.
Yes. Mhm.
Okay, so this action would be for the board to, retro coverage or extended reported coverage for property and liability coverage. Lynn kind of went over it, I think Zach also kind of went over it. This would be the cost for the 2 different options that are in front of you. So we would just need to, first, do you want the coverage? Second, which type of coverage do you want? And then the term.
Okay, you need 3 motions, you just need 1
Nope,
motion.
so I think if you just say that we're going to elect block coverage for this many years and at this rate, I'll make the wording work in the minutes.
Okay, is there any questions for the auditor by the commission?
What's the reason for purchasing this? Like, is there an actual controversy or something we need?
This is for the unknown.
Well, Yeah, I mean,
This would be the best way to explain
all
it.
insurance covers the unknown, I get
Well, this
that,
is for previous, prior to EMC, us ending with EMC and going to SDPAA, the unknown in this whatever extended, or whatever time.
Yeah, any claims that are unknown, that may be filed against the county that just provide for coverage. It's up to the commission, I guess, to decide how long that coverage would be, whether it's through our EMC or moving to SDPA.
That answer your question?
Well, not really, but
Okay.
not for lack of trying, I should say.
Any other questions for our auditor? Okay, then I guess,
Well, I do
any
have a
public input?
I do have a question.
Okay,
Sherry, did we get a 5-year extended from EMC?
I don't believe
For the
EMC
retro?
does a 5-year.
Okay, just the 3 is the max on that?
okay. Is there any public input? All right, then I guess we're to a point where we need a motion.
So yeah, the first one would be, do you want the coverage? And then which coverage? And then which term?
I'm gonna make a motion to purchase the 5-year retro coverage through the Alliance.
Okay, so that would be at the cost that we have there.
Okay.
The $48,790.82.
Is everyone clear on the motion?
Yeah.
Yeah,
That's
okay.
for what, 1 year, annually, what,
One time,
one-time coverage,
one-time payment.
one-time payment?
Yep, so the coverage would be looking back for 5 years and then moving forward.
Okay, we're clear on the
So
motion?
any liabilities we would have would be covered from that period,
That's my understanding.
yeah.
Did we?
I mean, I thought Lynn
It would cover the
explained it
time
to you
period.
and,
Well, I mean, this is where I have the confusion is, insurance is a contract. I mean, we'd be covered anyway, wouldn't we?
No.
no, not if it was before October 5th.
The Alliance is a claims-made policy, I believe. Zach, you know.
Well, this would have,
If I could jump in, but.
Sure, come on in.
So,
Just state your name and address.
Zach Jensen,
Yeah,
Beersford
thank
Jensen
you.
Agency. So what we're dealing with here is the professional liability for the county. It's for the decisions that are made by you guys, professional liability for law enforcement. So it's a claims-made policy, which is different than an occurrence policy. Our general liability, the slip and falls, things along those are an occurrence-based policy. The claims made it's a different type of policy. With EMC, our retroactive date for this coverage dates back to 1988. And even prior to that, however, in 1988, it went from an occurrence form to a claims made form in 1988. So from 1998 till October 5th of 2024, EMC would pick up any claims that would arise out of that time period, from 1998 to today's date. What we're dealing with, the decision that we have to make is, so when we get to this date of October 5th, as of now, and anything that may arise or a decision that was made 8 months ago, 18 months ago, 6 years ago, that were to become an issue or a claim be made after October 5th, okay? So the years that we're talking about is 1 and 3 with EMC. So if we were to choose a 3-year reporting period, that says basically we're gonna go out to 2027. Okay, so even though 24 to 27, we're not with EMC. But if a claim were to be brought during this time period, dating back prior to October 5th to 1988, okay? We're not looking back 3 years, we're looking back from 1998 to October of '24, but we're buying the reporting period, so that if a claim were to be reported within the next 3 years, there is coverage there. The 5-year just brings it out 5 years. However, I don't know how far back the alliance goes. You know, do they go back?
yeah, okay.
I don't know that, and I asked Sherry that, but.
We didn't have
How
a
far
second.
back?
We didn't have a second yet on my motion,
No,
did we?
we did not have a
Okay.
second.
I'm gonna amend my motion, to do,
Well, you won't need to if you.
well, I understand that. I'm gonna withdraw the motion and
Okay.
then I will make a new motion.
Okay,
To, purchase retro through, through EMC for the 3-year retro, because I do think that provides more coverage.
It's not retro, it's that you have
Extended
3 years
reporting.
to report it.
Extended reporting
It's-
coverage.
So
Right.
with what EMC has is you can go back to 1988 and you have 3 years to report it. But what SDPAA says is you can go back 5 years, but you can report it anytime.
So there's more coverage with the Alliance.
So if you have something, I think Lynn gave the idea of drainage. You did something 4 years ago, and now you have a claim for it. Well, now you can make that claim as long as you're with SDPAA. And what Zach, and correct me if I'm wrong, you can go back to 1988, but you can only report it for 3 years. So you have less time to report it with Zach, but a further look-back period. And you have a smaller look-back period with SDPAA,
Yes.
but forever to report it.
Yes.
Okay.
okay. All right, we
So-
still don't have a motion, but,
We still don't have a motion.
okay, are we clear what the motion is now?
We don't have one.
We don't have one.
I don't
Okay.
have a motion. So what's the difference in cost?
Well, it is 48,790.82 for the 5-year retro, or it's 56,000 for the 3 years extended.
And one's from EMC and one's from the Alliance?
Correct. SDPAA has got the first 3 there on the screen, and EMC has the bottom 2.
Can we get a recommendation from our chief civil deputy? Since you're the one that was gonna have to deal with this.
All comes down to how confident you are in yourselves too, I guess.
Again, that's why I'm asking you.
I honestly don't think you can go wrong either way. I mean, my recommendation would probably be, if you're looking from a cost and risk analysis, to do the 2 or 3 year, narrow it down between those two. The 2 year with the retro, or the 3 year with the extended reporting. So I don't think you can go wrong. Keep in mind statutorily, anybody who has a claim, they have to serve that upon the auditor with, I believe, 160 days from an act that occurred. So you have that protection. Now there's the unknown, where a claim arises that there was no knowledge until it happens. But at the end of the day, from a law enforcement perspective, I don't foresee that being an issue. From a county commission standpoint as well, you have a due process, you have public hearings, that's why you have those in place. So that's what my recommendation would be, either the 2 year retro or the
So yours
3 year
would be
extended
3
reporting.
years,
I don't think you can go wrong in either one.
3 years retro
The
Alliance?
2 year retro for Alliance, or the 3 year extended reporting with EMC.
Okay.
I know that's not narrowing it down, but I don't think you can go wrong in either one.
Have you ever seen a claim successfully litigated that didn't file the 4-month reporting form on the auditor or the finance officer?
Not that I can think of, no. And you probably be just aware as I am.
I'm very aware, but I want the public to know.
No, I don't think so,
Yeah.
no. There may be some issues that may arise that I'm not aware of, that there wasn't knowledge, and so there's obviously those claims that they can make, but typically, you know, and I think you're well aware of some of the attorneys that handle those cases around Sioux Falls area. They're very quick to file those with the auditors and provide notice.
Thank you.
Yep.
Thank you. Well, we need to make a decision today.
Then I would move to purchase the extended reporting through EMC for the 3-year extended reporting.
And that is your motion?
It is.
I'll second that motion.
Okay, we have a motion by Landine, a second by Schmidt. Is there any discussion? Okay, I guess then, Alicia, call the roll, please.
Commissioner Aaron's,
No.
Landine,
Yes.
Schmidt,
Yes.
Gibbon.
Yes. Motion carried. Next, we go to item number 8.
All right, so this item then is to decide, wherever my paper went, to retain Jensen as the agent between us and Public Assurance Alliance, I believe is what it is. Where did my paper go? And that would be, what I have is at a 3% cost of the rate, wherever it went. So this is how your premiums would look. So what you did, we would come on here with no retro. I'd have to look at this because she's only got, okay, this is it. Where'd Vanderwood go? So there's where you sit right now for what the cost is gonna be.
About, is that both together?
Yep, so the left is with an agent, the right is without an agent.
And they both say no retro, so.
Yeah, there's no retro on it because you chose EMC.
Any
That will be
questions
billed separately.
for our auditor? Zach, anything you want to add? At this time, your opportunity.
I guess, you know, whether or not, you know, we're involved, you know, like I mentioned before, we appreciate the relationship that we've had over the years and would certainly entertain continuing that. At whatever level that may be on our part, working with Lynn, I don't know what that involvement would be, if claims and changes and, you know, the path of communication that has been there with all of us in our agency that handles all of that. I guess that would be up to Lynn and possibly you guys, if we want to continue that path. And whatever involvement you would choose to have us involved, I guess, so.
Okay, thank you. Any input from the public? Okay, I guess then, board action, I'll entertain a motion.
Can you, I was looking at those numbers.
Oh, sorry.
Can you put it back up? Sorry.
I just want to make a
Thanks.
mess for you.
Thank you. I got him. Zach, is it a 3%?
Yes, that's what you have built in.
I know that's what we have built in, but is that what the charge would be, is the 3%?
Yes.
Okay.
Would you do it for 2?
Well, that was, I guess Lynn's doing, I guess, more or less.
It's a 1-year contract? This,
No, well, it's built in
You wanna
each
go up to the
year.
next one?
Oh, yes, sorry. It's built in each year you know, typically in insurance policies, there are agent commissions that are built in, you know, continually each year. And so it's not a one-time, it's built in annually, so.
Yeah, and if we want to modify it according to the Public Assurance Alliance contract we signed, we have to give 60 days notice prior to, the end of the year? So if we wanted to modify that, we actually have to give notice of termination with SDPAA, and then we'd have to do a renewal, right?
I didn't know that.
So it's in the document you signed, Mr. Chair.
Oh,
I guess that would probably be a Lynn question. I don't have the answer for that.
So, Zach, not to belabor this thing, but, so she just threw in 3%. So it could have been 2. Could have been 1,
Could have been 15.
could have been 15. So, out of the air, okay. So what prevents us from saying it's worth, we'd like to have local things, but it's only worth about 2% or whatever? You don't have any say in the matter then, right? Or is it a pain for you to do that?
You know, I guess it's probably a negotiating thing, you know, and with Lynn, and I guess what involvement would you want us to have, more or less?
we don't have time for this, do we? I mean,
You have time, all the time in the world.
I'm,
This is just deciding whether he wants to be, whether you're gonna have Zach as the agent or not. What it comes down to is, right now, we're saying, hey, Zach, you're gonna be the agent for all of our stuff, so you're gonna do everything you're doing now, but you're only gonna get $8,000 for it. That means handling, we call him, he has to call Lynn, and then, you know, he tracks them. I have no idea what that means. To me, it seems like we'd have two agents having Zach in there.
Mr. Chairman?
yes,
I think Jensen Insurance Agency has done great work for the county. I mean, when you talk about a 44-year relationship, that's incredible. But unfortunately, the economics of the insurance industry have gone to heck, and, right? I mean, to put it nicely. And it's unfortunate that the relationship comes to an end. It's obviously because of the economics, not because of anything that the county or the Jensen folks have done. They've served us very well. So that's the sugar, Zach. Let me give you a little salt. And this is not intended personally at all, but my understanding of how the claims process works with Public Assurance Alliance is basically the auditor or the state's attorney or somebody will basically just shoot an email to Lynn's representative, and that is the claim. And so just from a mechanical perspective, you know, and again, no offense to the Jensen folks, but if we already have people on staff here who we pay, who can just shoot out a claim, you know, I would just as soon have them communicate directly with Jensen, or excuse me, with Assurance Alliance, because that's just how it works. And I don't think, and again, no offense intended, we just don't need a middleman in order to send an email claim.
thank you.
It is gonna be a lot of
I kind of concur your thoughts as well.
that does sound like a lot of work for not very much pay. I know that feeling sometimes. I gotta agree with Commissioner Aaron's on this one. Just for the reasons that he stated, I don't think adding more people into the chain of a claim helps anything. But I also want to thank Jensen Insurance, for all the services that you provided to our county and other counties throughout the years. So, thank you.
Thank you.
Is that your motion?
Do we need a
That's my
motion?
motion.
So the motion will be to not retain Jensen Insurance.
Well, I'm gonna make it in the affirmative, so
yep.
it is a motion to retain Jensen.
Yep.
Okay, we have a motion. Is there a second?
Second.
Okay, any discussion? Call the roll, please.
Commissioner Aaron's?
No.
Landine?
No.
Schmidt?
Yes.
Gibbon?
No. Motion failed.
Truly, thank you, Zach, and tell your dad as well, please.
Next, moving on, Madam Auditor, you're here for number 10.
Yep. So last week, we discussed getting a committee together and making a formal for action to get a committee together to do a study for the Lincoln County Public Defender Office. Are going to be tasked with the 3 options we have available. It'd be continue with the current practice of having a public defender service contract, establish a Lincoln County Public Defender's Office, or join with Minnehaha County Public Defender's Office. So my recommendation for the committee, notwithstanding the commissioners, would be to have Chief Civil Deputy Drew DeGroot, Judge Rasmussen, myself, and Tracy, and then 2 commissioners. So whichever 2 commissioners, that would be mine.
Yeah, I'll go ahead and do that. I've been in discussions with Minnehaha County, and so I think it would make sense if we're gonna look at an option with, working with Minnehaha, that we actually have 1 commissioner, from here, and then a Minnehaha County commissioner as well.
Oh, that makes sense.
So I would,
Did you
like
have
to
a-
put Joe Kipley on that, since I've been in those discussions with him.
Okay. So instead of having 2 commissioners from here, have 1 from here and 1 from there.
Correct.
Makes sense to me. Other than that, were you okay with the?
Who else did you have? You had Drew?
I had Drew, Judge
One.
Rasmussen, myself, and Tracy.
So one commissioner from here, and then where's the other one from?
Joe Kipley from Minnehaha.
Okay,
And
And
then Drew,
he's agreeable to doing
Is he?
that, yes.
Drew, Judge Rasmussen, myself, and then Tracy.
I would so move on that committee that's been outlined for the public defender.
okay.
And I'll second.
Then we have a motion and a second. Any public input? All right, any further discussion by the commission?
Drew?
I'll just add a comment. That the committee would just be providing a recommendation, no other authority, so wouldn't be subject to open meetings or anything like that. It's just to provide a recommendation to this board to move forward, so just wanted that clarification.
Thank you.
And that'll be the same clarification on the next committee.
You know,
All right,
can we, was there talk of adding Tracy Smith to that, since she's kind of running the show? If we could,
We could certainly, I guess, discuss that. You already have a motion on the
right,
table,
so
which you can-
I want to add her, so,
She'd obviously have a level of expertise that,
right.
from running a public defender's office for the last how many
So
years.
if we could just vote on the motion that's pending, I'm gonna vote no on it because I would like to add Tracy Smith to it, if she's willing to do that.
Well, I'll make a motion to amend, add Tracy Smith.
okay,
And I'll second.
all right. We have a motion and a second to the amendment to the motion. Is there any discussion? Okay, voting on the amendment first. Call the roll, please.
Commissioner Aaron's?
Yes.
Landine?
Yes.
Schmidt?
Yes.
Gibbon?
Yes. And the motion then is the same thing, correct? No, it wouldn't be the same thing.
It'd be this, with adding Tracy Smith on it.
Yes,
We have an increase, okay?
yes. Okay. Call the roll, please.
Commissioner Aaron's?
Yes.
Landine?
Yes.
Schmidt?
Yes.
Gibbon?
Yes, motion carried. Last
Right.
item, Sherry?
So this now is a committee established to review the budget process. As I discussed last week, we haven't had a solid process for budget consistency as far you guys, the public, the department heads. So I kind of wanted to get a committee together to look at a timeline, expectation, and process. And I would say my recommendation for that would be myself, Amy from my office, Paul Anderson, Jake Oakland. I can get a couple more department heads probably, but we don't have the department head meeting until the 9th, so I would talk to them. So if you wanted to say that lineup, or just approve the committee and we can go with this lineup, or I don't know how we want to do it, and then, put another one. I was also thinking about an outside person. I haven't got confirmation or talked to them of their level of commitment to it. They do a budget right now for a governmental agency, so their input might be valuable. So I don't know if you want to just say we can establish the committee and then let.
How many?
do
An
this.
outside citizen or outside resident?
Yeah.
of Lincoln County.
So another department head and then outside, and again, same as Drew stated before, we wouldn't be making any policy,
so-
we would just be a
So we have the
recommendation.
auditor and how many department heads?
I would say probably 2.
Department heads, 2, and then.
Paul Anderson.
How many commissioners do you want?
I think at least 1.
Commissioners, 1.
You want to do
okay.
that,
I'll
Schmidt?
volunteer.
Okay. Jim Schmidt. Okay, and then who else?
And then the outside person,
And the outside?
yeah.
Jake
I'll,
there, too.
I'll wait
Oh, and
to,
Jake as well?
Jake, yep. So I've got Commissioner Schmidt, myself, Amy from my office, Paul Anderson, Jake Oakland, 1 more department head, and a possible outside person.
So is that 9?
7,
7 I have.
And that includes you?
yes.
Okay. Then, Mr. Chairman, if you're ready for a motion, if you want to take public input first, I'll have a
Yes,
motion.
public input on this matter? No public input? Okay, then I guess I'll entertain a motion.
I would move to establish the committee to review and submit recommendations for the budget process, not to exceed 7 people.
Is there a second?
Second.
Okay,
Mr. Aaron's.
I think Commissioner Aaron's has the second. There's a motion and a second. Any discussion? Okay, call the roll.
Commissioner Aaron's?
Yes.
Landine?
Yes?
Schmidt?
Yes.
Gibbon?
Yes, motion carried. Moving on, I guess, any public comment now on opportunity for public comment? None? I guess then any commissioners? Any reports?
Mr. Chair,
Yes.
you and I went and visited a most entertaining new business that's in our town, or in our county, I should say. You perhaps know more about it, but it's a recycling of plastics. It's very futuristic, and I was blown away by what it can do and what's its potential. So maybe you
Yes.
have a comment too.
Yes,
Mr.
and
Chair.
this is, of course, located at the intersection off the Canton exit, I-29, and on the west side of the exit. They are taking enormous amounts of plastic, different types of plastics from all over, and of course, are making fence posts. Paul Anderson went with us also, and, I know that the owner was here a couple of years ago, after he got his conditional use permit, and shared some of his ideas, and, yeah, he's doing some fascinating things, great vision, and we're very, very happy for him, and I think he is going to venture out and start making some other things as well. So a product that is environmentally sound and at the same time is more durable and, just out of people's waste that they throw away that would end up in a landfill or the bottom of the ocean or whatever. And so it's a very nice business venture. So we're going to keep our eye on it because I think there's more to come there. All right. Anything else? Do we have executive session, Drew? Nope, okay. I guess then we need a motion to adjourn.
So moved, Mr. Chair.
I'll second.
Okay, a motion by Smith, second by Landine. Any discussion? Call the roll, please.
Commissioner Aaron's,
Yes.
Landine,
Yes.
Schmidt,
Yes.
Gibbon.
Yes, we are adjourned.